Have you ever seen a thumbnail claiming that one single fruit can cleanse your kidneys overnight? It sounds incredible, and it's exactly the kind of promise that grabs attention. But here's the truth. Your kidneys don't work that way. No fruit, drink, or supplement can magically detox or cleanse your kidneys overnight. Your kidneys are already your body's natural filtration system, working every minute of every day to remove waste, balance fluids, regulate blood pressure, and keep important minerals in the right range. That doesn't mean fruit isn't important. In fact, some fruits can support kidney health when eaten as part of a balanced diet. The key word is support, not cleanse. Today, we're going to separate myths from facts and talk about the fruits that may help keep your kidneys healthy, why they work, and who should be careful before adding them to their diet. Your kidneys filter around 150 to 180 liters of blood every day. They remove toxins through urine, regulate sodium and potassium levels, help control blood pressure, produce hormones that make red blood cells, and activate vitamin D to keep your bones healthy. That's an incredible amount of work for two organs about the size of your fists. Because your kidneys already filter your blood naturally, the idea of an overnight kidney cleanse simply isn't supported by medical evidence. If your kidneys are healthy, they're already doing the job efficiently. If they're damaged, eating one fruit won't suddenly repair them. So why do people believe these claims? Usually because certain fruits contain antioxidants, vitamins, and water that support overall health. Over time, these nutrients may help reduce inflammation, improve heart health, and indirectly benefit the kidneys. But that's very different from instantly flushing toxins away. One fruit that often comes up in discussions about kidney health is watermelon. Watermelon is made up of more than 90% water, making it excellent for hydration. Staying hydrated helps your kidneys filter waste more efficiently. Watermelon also contains vitamin C, lycopene, and antioxidants that may reduce oxidative stress in the body. However, people with advanced kidney disease may need to limit watermelon because it contains potassium. Another fruit with strong scientific support is blueberries. These small berries are packed with anthocyanins, powerful antioxidants that help protect cells from damage. Studies suggest diets rich in berries may reduce inflammation and support heart health, which is closely connected to kidney health. Healthy blood vessels mean healthier kidneys. Cranberries are famous for urinary tract health. Many people assume they clean the kidneys, but that's not exactly true. Cranberries may help reduce the risk of certain urinary tract infections by making it harder for some bacteria to stick to the urinary tract. Since untreated urinary tract infections can sometimes spread to the kidneys, preventing infections may indirectly protect kidney health. However, cranberry juice should not replace antibiotics when an infection is already present. Apples are another excellent choice. They're high in fiber and contain compounds called polyphenols that may help reduce inflammation. Fiber also supports healthy blood sugar levels, and maintaining good blood sugar is one of the best ways to protect your kidneys over time, especially if you have diabetes. Grapes contain resveratrol and other antioxidants that may help reduce inflammation and support cardiovascular health. Since the kidneys rely on healthy blood circulation, anything that benefits the heart may also benefit kidney function. Strawberries are rich in vitamin C, manganese, and antioxidants. They may help reduce oxidative stress, one of the factors involved in chronic diseases. Again, strawberries don't cleanse your kidneys, but they can be part of an overall kidney-friendly diet. Pineapple is often recommended for people with kidney concerns because it contains less potassium than many tropical fruits. It's also a good source of vitamin C and bromelain, an enzyme that may have anti-inflammatory properties. For some people following a kidney-friendly meal plan, pineapple can be a smart option. Now let's talk about lemons. You've probably heard that drinking lemon water dissolves kidney stones. The truth is more complicated. Lemons contain citric acid, which increases citrate levels in urine. Citrate can help reduce the formation of certain calcium kidney stones in some people. Drinking water with lemon may be one small part of a kidney stone prevention plan, but it won't dissolve large stones overnight or replace medical treatment. Oranges provide vitamin C and fiber, but they also contain significant potassium. Healthy people can usually enjoy oranges without concern, but individuals with advanced chronic kidney disease may need to limit them depending on their doctor's advice. Bananas are another fruit that often creates confusion. They're nutritious and rich in potassium, which is essential for normal muscle and nerve function. However, if your kidneys can't remove excess potassium effectively, eating too many bananas could be harmful. That's why kidney diets vary depending on kidney function. The biggest factor supporting kidney health isn't one fruit, it's your overall lifestyle. Drinking enough water throughout the day helps your kidneys remove waste efficiently. The amount each person needs depends on climate, activity level, and health conditions, so there isn't one perfect number for everyone. Managing blood pressure is equally important. High blood pressure damages the tiny blood vessels inside the kidneys. Over time, this reduces their ability to filter waste effectively. Eating fruits, vegetables, whole grains, and reducing excess sodium can help maintain healthy blood pressure. Blood sugar control is another major factor. Diabetes is one of the leading causes of kidney disease worldwide. Consistently high blood sugar damages the kidney's filtering units over many years. A balanced diet, regular physical activity, and following your healthcare provider's advice are among the best ways to protect your kidneys. Reducing excessive salt intake also matters. Too much sodium causes the body to retain fluid, increasing blood pressure and placing additional strain on the kidneys. Choosing fresh foods instead of heavily processed meals can make a significant difference. Exercise also plays an important role. Regular physical activity improves circulation, supports heart health, helps maintain a healthy weight, and improves insulin sensitivity. All of these factors indirectly protect kidney function. Let's also clear up another myth. Some detox teas claim to flush toxins from your kidneys. Many of these products contain herbal laxatives or diuretics that simply increase urination. Urinating more doesn't necessarily mean your kidneys are healthier or cleaner. In some cases, excessive use of these products may even lead to dehydration, which can stress the kidneys. Supplements marketed as kidney cleansers should also be approached with caution. Unlike prescription medications, many supplements are not tested as rigorously for safety or effectiveness. Some herbal products have actually been linked to kidney injury. Always consult a healthcare professional before starting supplements, especially if you already have kidney disease. How do you know if your kidneys need medical attention? Early kidney disease often causes no symptoms at all. That's why regular checkups are important, especially if you have diabetes, high blood pressure, or a family history of kidney disease. Blood tests measuring creatinine and estimated glomerular filtration rate, along with urine tests checking for protein, are much more reliable than any online detox trend. When kidney disease becomes more advanced, symptoms may include swelling in the legs, persistent fatigue, nausea, changes in urination, muscle cramps, itchy skin, or shortness of breath. These symptoms require evaluation by a healthcare professional rather than home remedies. What about kidney stones? Certain fruits may help lower the risk depending on the type of stone. Citrus fruits like lemons and limes can increase urinary citrate, which helps prevent some calcium stones. Drinking enough water remains the single most effective strategy for reducing kidney stone risk for many people. People often ask whether fruit juice is as healthy as whole fruit. In most cases, whole fruit is the better choice because it contains fiber that slows sugar absorption and supports digestive health. Many commercial fruit juices contain added sugar, which can contribute to obesity and diabetes when consumed excessively. Another important point is portion size. Even healthy foods should be eaten in reasonable amounts. Eating a variety of fruits provides a broader range of nutrients than relying on just one so-called miracle fruit. If you already have chronic kidney disease, your diet may be very different from someone with healthy kidneys. Depending on your stage of disease, your healthcare team may recommend adjusting potassium, phosphorus, sodium, protein, or fluid intake. That's why personalized nutrition advice is much more valuable than viral internet claims. Here's what the evidence consistently shows. A diet rich in fruits, vegetables, whole grains, healthy fats, and lean proteins supports heart health, and healthy hearts support healthy kidneys. Long-term habits matter far more than short-term cleanses. So if you're searching for the one fruit that cleanses your kidneys overnight, the honest answer is that no such fruit exists. But if you're looking for foods that support kidney function over months and years,